Hello, everyone. So I'm going to talk about kind of a latest updates in genomics and healthcare in correlation of artificial intelligence, large language model, and foundation models. I personally am advocating for the integration and application of the machine learning models, then later on large language models, artificial intelligence, and foundation models in genomics, clinical care, and all those relevant to us for some time, especially as much I can recall since 2020. Uh, so it's been an absolute pleasure for myself to be on the field early and to learn the whole things of genomics, AI, healthcare, and how we can implement this, integrate with our current systems to identify new mutations, drug resistance, by the mechanism of genomics level, then finding new targets also, designing new drug, optimizing the current drugs, and eventually helping our patients to cure is the main purpose of all these things. So I'm happy that all these AI companies nowadays has been more integrated. I personally talked with the OpenAI teams, couple of directors in NVIDIA, a good number of people in Anthropic. So it is what we are going in, and we all should be integrated more in there. So as an effort of myself, I have started it now so that I can provide weekly, at least bi-weekly, the updates on this relevance. So everyone doesn't need to be in the full extent of searching for everything all over the days. Okay, let's go. It will be short, not that long, actually, definitely, so that you can go through faster. Let's begin with. So, genomics and healthcare, artificial intelligence, large language models, and foundation models. I myself work in Mount Sinai Hospital and I can School of Medicine, and I have my email address and everything. So, if you guys want, you are welcome to connect with me. Okay, let's go. The second one. So, what we are focusing on? We are focusing on six areas, which is genomic foundation models, single cell and spatial AI, clinical validation, big tech, including the OpenAI, Anthropic, Microsoft, NVIDIA, healthcare race, industry and LLM agents, and regulation and ethics. I will touch all of these. I will upload these into the YouTube and LinkedIn and Twitter so that anyone who is interested can go through these. And there is a valid links for each of these models and the works. So if you are interested, you can always go through this. Let's first go to the genomic foundation models. So this has been a very good time actually. That's EVA 2 has been released. And what it does, let me just go through the links and show you a little bit. I am not sure that I can go with each of them like this, but let me just go. So this is the link. This is EVA 2. So it's mostly by the people from Arc Institute in Palo Alto. So if I go through this, it's genomic modeling and design across all domains of life. And they have given this overview model architecture. It's published in Nature. So if you go to the application layer, you can do the prediction level, which is gene accessibility and genetic variant effects. Then design genomic scale generation Also, the prediction has different ways of it. Then you can go to the protein levels and protein complex generation designing. Then you can go to the RNA levels, and you can also go to the exon levels, regulatory component. You can go to the chromatin accessibility and foundational layer they have in there. So it's a pre-training. They have 8K context and then 8,000, and mid-training they have 1 million context. They had a lot of things. It's a fantastic model. There is undoubtedly anything that you can doubt on this. This is a enormous work. It's a 40 billion parameters they have added up in there. I would suggest anyone who is interested to go through and read this paper. This is probably one of the few important topic of this whole talk. And Patrick Soon and Brown he with Garrick Brixey have done this phenomenal job. I have to admit it. This is a beautiful work. Congratulations to the authors. What it does in like you can simply see that zero shot pathogenic variants prediction. You have a whole mitochondria and prokaryotic genome, and then autonomously learns exon intron boundaries, transcription factor binding site, protein structure. It's a it's a beautiful work. There is no doubt. Oh, and if you want, okay, you want to search it, just you don't need to do much actually. You can just search Ubuntu, and then you can go to the Arc Institute, and they have this beautiful page which has all the links. You want to go to the Hugging Face, you can go in there and get the model, and then you can also go to the GitHub, and you can find the all details in there. They have beautifully updated it. This is fantastic work, and if you want more of these updates, you definitely need to go through my GitHub page. It's like a lot of my softwares and other people works that's been integrated in here. You're welcome to go through. The next part, I'm going fast, I know, but you know what can I do? So alpha genome and ISO-DDA, that's a deep mind kind of a dual breakthrough. Alpha genome, it's like DNA input models. Then it has a lot of new parameters. If you just go through this model work, let me just add this up and show you. So uh, you can go to the target spin of exclusive new AI with isomorphic lab, and you can follow this guy. What's his name? Demis, and he is a. I mean, how- yeah, Demis Happis. Yeah. So he's a fantastic guy. He has done an enormous job, and I believe that you can follow him and get updates in there. Then you have ISO-DDE proprietary. Okay, that's fine. Therefore, antibody design, protein ligand prediction, and a lot of fantastic work around there. Just in simple way, like if you want to genomic foundation models head-to-head comparison, so you have able to alpha genome ISO-DDE generator. You can see there, say, Ubuntu has 40 billion parameters. They are fully open. Some are non-commercial. Uh, that's these are all recent publications. So I'm talking. I'm not going back because I want to give a regular update and share with the people who loves to work on this and will be pioneering the entire AI integration into healthcare and so that we can cure the patient disease. I'm not a businessman. I'm not a profit, getting any profit from big companies. So it's a voluntary self-debuted work that I'm sharing right now. So it doesn't have much of like my benefit in here. So I'm whatever I'm saying, it's from the neutral point of view and a pure uh, or authentic judgment and nothing to bias to anyone. So either way, so you can see the parameters, bases, number of bases. So you can see the variant prediction. What are the primary tasks? So Ubuntu is doing variant prediction, genome generation, regulatory variant effect prediction, protein ligand structure, enhancer design, and generation. You can get all of these publications link from here if you are interested, and you are welcome to. Now, the second part. I know I'm going fast because I have to finish up and no one listens a long lecture. I'm kidding. It's fine. So, single cell and spatial AI, promise versus reality. So, there's a lot of discussion since last couple of years. That's people keep saying, okay, the foundation model is changing the everything. I agree to disagree at some extent because the foundation model still has been struggling to generate the output that we have been expecting for some time. But it is the reality. So uh, someday we'll generate the foundation model that will be overcoming all these limitations. We just need to keep working, right? So what are the new foundation model? So you have S-long. It has 1 billion parameters. It's insanely good. Then you have CLMX. You have Stark and Cellama. So let me just go one of them. I can't afford to go all of them, but I'm happy to, if anyone interested, to discuss details with me and elaborately any of their interest. Okay, a Sibylian. So what is it? A Sibylian, a billion parameter foundation model for capturing long range gene context in single cell transcriptomics. So it's Eric Wang and Pentagog Ji. They are from Mohammed bin Jayed University of Artificial Intelligence. So that's anyway. I hope the people in there is good. Um, Machine learning models, Carnegie Mellon University. Okay, that one I know. Hmm. So SC long, how does it work? This foundation model. Let's see what did they say. So they're saying with 1 billion parameters they have and pre-trained on 48 million cells. That's insanely good number of cells. So I have been using different transcriptomic technology from the 10x to the BD, and I have done in single cell with the BD up to 100K cells in one sample. That's like 100,000 cells. That's insanely good. So that we have a huge leap in technology in here. And I mean, I have been optimizing for this in the lab side also, as well as AI applications. So primarily, I'm an immunologist. So it's been fun to be on the hybrid area where I believe that the future will be led by the people who have expertise on the wet lab, clinical science, as well as the AI, so that this hybrid generation will lead the more comprehensive and faster drug identifying the cause of disease by transcriptomics and all those things, by genomics, and then designing the drug, developing the drug, testing it out, and the treating patients. So the time that it used to take the 20 years or more, that could be significantly reduced. And I'm writing it to turn into 2 years. I mean, that would be fantastic. So let's go. Gene expression. The Long had this simple model. They have used the dual encoder architecture and gene ontology knowledge. Gene ontology has, if you go back to the GO, that's a kind of a pathway analysis way of the different transcriptomic analysis we are using all the time. So let's see model architecture. You have gene expression, and then you are going the gene ID that comes in the gene ontology, gene representation, expression presentations, and then element representation, which divides into high expression representation to the large performer encoder and the low expression representation mini performer encoder. They both integrate together and produce this full length performer encoder that goes to the contextualized representation. It's a beautiful work. And if you see the pre-training, which they have done on 1618 single cell data sets, that's insanely good. And I hope they maintained all the quality controls in a very precise way, well, as much possible, on 48 million cells, preferably on blood, brain, and other organs, and 27,874 genes among them. A significant portion do the protein coding. That's very important. So this is a very good publication, and I would recommend people to read it. It's been published in Nature Communications, and anyone have any question about any of this publication that I have been talking in here, which I have read them. So you are welcome to ask me. I hope you'll read others. Now, benchmarking reckoning, like do foundation models beat baselines? Okay. Uh, Someday they will definitely be. Five foundation models, if you say, they fail to outperform simple linear baselines for perturbation prediction. So, mhm, that's something that a lot of people don't like, but I don't see it like this. That, okay, it has to cross now. It has to be good now. It will be better in future. So why to be too strict now and disappointed now? It's a work in progress, not a one night work. Um, so if you see different things like this, okay, you look at the figures and okay, can I? Okay. huh, um, Foundation models. This one is a little bit. I mean, say the end of them accepted in the end of last year, so it's not that old. So you can see the scenarios. You have the context and perturbation data sets, models. They have used a lot of models in here, deep learning models, linear models, as C-bars network, a lot of them in there, 18 methods they have used, and then evaluation they have done. And according to their evaluation, you can see, well, I don't want to go in there. I don't want to say much. People will be angry on me. I don't want that. So this is all the models you are welcome to explore. Now we are coming to our third portion. What is the clinical genomics process measure validation threshold? So this is something that's very important because eventually we want to apply it into the clinical aspects. So this is one of them: the predicting oncotype DX from H and E, hematoxylin, and using slides. So that's everything. Because um, uh, let me just go through this. So let's see. Okay, this is the paper. I'm just simply copy pasting. Uh, on my computer is. I need to update it. It looks like that. Okay, let me cut a couple of them. Okay, it looks like there are certain issues in there. So let me try in a simpler way. Okay. Yes, yeah, that doesn't I want. That's in Lancet. Okay, I have this one. Um, Okay, so this is a paper where they're talking that from the H&A staining, they you can um, uh, I get a predict breast cancer recurrence risk and chemotherapy benefits. And one of my colleagues, some uh, senior colleague, Joseph Esperano is in there. One of them, he presented it earlier in our um, mm, Thursday meeting. That's a kind of clinical round, grant round meetings or something like that. Okay, so if you look at this picture, you can see HND slide and then segmentation and tiling, HND tile level feature extraction, tile feature vectors, transformer encoder, and finally performance evaluation. This work is good. Hmm. So let's go to the another one. This is one of my colleague, ex fellow in our places. So is in he worked on this and let me just see if I. Uh, so he was a fellow in Mount Sinai and then he left in there. So what he has essentially done is that you take the um, HNT slides, kind of a HNT slides base. Then you train the data and validate it, and then classify them and publish in here. This is another RAG LLM for precision oncology. That's great. Then liquid biopsy and AI-driven precision medicine. It's a great amount of work. Tempus AI has been a quite force as much I see it from the very beginning. And let me just go through one of these, like spatial omics and AI, clinical grade breakthroughs. So let me go through this one and talk about this. I know I'm going faster, but you are welcome to comment on this. Let me just go to spatial transcriptomics with model context protocol server. If you see my videos earlier, that's I have been talking from the very beginning about model context protocol, and I have a substantial number of uh, work that's probably one of the richest collection of the skills. Let me just show you that um, goes through everything that you need to do in clinical area, um, and have all the skill like this one. If we go through this, it's not that popular because I don't know the lot of circulation. But if you go through these skills and you have everything that need to be done into the clinical and genomics area or anything that's relevant to it. This is the most enriched and extended encyclopedia of every single skills that could be required in the life science and clinical practices to implement and integrate with AI and large language models. So this has been quite a force in here. It took me some time. I have started developing it actually the uh, end of 2024, and I have been using it a lot. It has a lot of things, including the multiomics. If you, for example, if I go in multiomics integration in there, you have different data harmonization, mix ceremony, a lot of things. I just don't want to get people. Okay, it's too much, huh? So there are areas where you can go, like let's say transcriptomics. You can go in there, you can see what has been done. Every single thing that you need to do is integrated in here. Any LLM model you put it there because it has universal um, uh, universal adapters to integrate. This is a kind of a autonomous agent. So you connect your AI and ask it, okay, use these to do the analysis. Any AI, ChatGPT, Claude, Gemini, um, DeepSeek, Mistral, any open AI coin, whatever you want. Just connect it with it, and it will autonomously find it out in every context and do all the work for you, like an expert on the field, without even knowing you anything. Just write, do it, done. This is my data set. Do this task. Find the skills here. Done. It's a very easy work. So the one that I was trying to search for you is that this one, right? So sorry for that. Okay, let me just go in there and see. Okay, so the idea of the paper is special transfer model context protocol. So that's a good work. The people of the nice people of no, no, Ahio probably is doing a amazing job. So this is the idea they have. The MCP host you have. Um, well, they are using Cloud Desktop. Okay, that's a different game. The spatial transcriptomics orchestrator, data loading, pre-processing, some visualization, analysis, result, and visualization. It looks very simple, but that's great. Okay, big tech healthcare. I should talk a little bit more on Tempus AI. Yeah, I think they do enormous branding of themselves, so I would just leave it. Now, let's come to the one of the big area that's called the big tech healthcare AI race. Well, that's the billion and trillion dollar game. So, when we academicians struggles all the time. Okay, so let's go. Five companies, 10 weeks, and healthcare transform. First, what the ChatGPT has done. ChatGPT has done enormous work in recent days where they have integrated the healthcare and a lot of HIPAA protocols and a lot of other things that we require for the application of modern integration and application of AI into healthcare. So if we just simply said, okay, open AI healthcare, You can get their update. I'm not going in details, but they introduced it in the last month, and they're doing enormous amount of job. I'm a big fan of them. I in their in New York, Soho, when they called us in the developer meetings. I have said them, I talked with them as much as possible and tried to suggest them also again. That's the two. It's how important, it was some time ago. How important is it for us to work in healthcare in integrated manner rather than being tech playing in one role, and the people who are in academia, in hospitals, we are playing a different, separate island, not like that. It's not an individual, it has to be integrated, connected, and a force of nature to improve the healthcare for everyone. And that's the idea should be implemented. That's what I'm talking about. Okay, now you can find everything in here. I'm not going in details, but I'm sure that you can get a ton of their work. Um, okay, then we come to the Anthropic. The Darius Anthropic has been doing an enormous amount of work, and oh, don't go to the JPM 26. It was insane. People are doing meeting in the car because the space was too insanely pricey. I mean, I don't know how people do it, but cloud health is been quite a force. Let me show. So they have actually released couple of apps with ChatGPT also done. Then the where you can connect your health data and all the data, and it goes through this. It helps you, the suggests you. A lot of things has been done in that areas. You can go through this page. I probably need a whole separate videos just to make on this context that how these big companies are pouring billions of dollars on this very essential task. Built for healthcare. See, AI you can trust. Powerful and contextual, made for healthcare. Your partner in better care. It's insanely good. And you can connect it that with the different. They are working with different. I think I had a video at the beginning, but I don't remember exactly right now. But it's an enormous amount. I'd probably make a different video with them. Microsoft has been a pioneer from the very beginning. They with Azure platforms, they have been implementing a lot of things with AI. And another force that I haven't mentioned in here is Amazon AWS. We have this. They have been doing fantastic amount of work with this Amazon AWS. I mean, they have been implementing this AI agents across the places and into their bedrock and all those contexts. And there's huge. We have this meeting, I think, next month, AWS Healthcare Forum, and that's fantastic. The NVIDIA has done a tremendous job with Ililini. So with Michael Fast, an NVIDIA director, was talking in the NVIDIA GTC, the last one on sharing stage, and they have co-invented, they have a co-innovation lab. That's 1 billion for 5 years, and it's insanely good amount of work. It's always on my mind. Michael Fast was from like Mount Sinai colleague, and he moved in the Ililini, and he is doing absolutely phenomenal work. He has been leading the Ililili to be a giant in the field. I think they already have done it. Let me just see. See, you just search this. See, $1 billion money. Mm. And they are already benefiting from drug production and a lot of things. So it's Ililili and Roche or Genentech has been the two pioneer compared to any company on the field to lead the AI innovation and implementation, integration with healthcare, pharmaceuticals to show the to be the pioneer to show the way it can be done. I mean, I'm a big fan of NVIDIA, and I talked with many directors over the course of times. And Lily, it's a fantastic journey. And I talked about earlier about that Alpha Genome, Deep Somatic, Google DeepMind has been a Well, major player for very, very long time. So I don't need to give introduction of the Google DeepMind or Demis or the people they are doing. They have been a to enormous force. Another thing I need to mention and which I haven't integrated in here is the beautiful Chan Zuckerberg initiative by Mark Zuckerberg. So Chan Zuckerberg BioHub has been, I would say, one of the force or the power that brings the AI in the more real times. Like I am working for some time with the virtual cells, and I can't emphasize how brilliantly they are working on these. Mark Zuckerberg and specifically his wife. Uh, Sorry, the beautiful Priscilla Chan has been doing this enormous amount of work on the biohub to integrate it, and she has been personally involved with this. I think this is the fantastic amount of work they are doing it, and it's incomparable. I mean, they are spending billions of building up. It has done the CX cell gene, and a lot of work they are doing. I mean, I don't know how to say it, but that's why I said I probably need another whole session just to talk about these things. These are some notable milestones which I don't want to go into there right now, about the money and everything. This is all about like um, different okay. Um, billion-dollar AI genomics AI deals and IPOs that's coming in there. That's fantastic, but I am happy to discuss with anyone who has similar interest. Now, LLM agents are coming into the bioinformatics. That is a very important point. That LLM agents play significant role in everything nowadays. When I'm working in a normal day, my 3, 4 agents are working all the time, and they have the sub agents each of them. So this is a huge amount of work. SAPilot is one of them. I mean, SAPilot is doing fantastic work. Then you have Cell LLMs Fold, MTSCP. These are beautiful things. I mean, I would suggest anyone to read those things. Like, for example, if I give you this, so you can see DCSD lovely people have done this raw single cell matrix. Okay, let me make it bigger. I don't want people to be confused on this. And I'm not big of making confusion. Not a big fan of making confusion. Okay, raw single cell matrix data. You have metadata. You have existing tool. Okay, you take the Surat, gene ontology, monoclonal. Well, it looks like that. Cynic Plus, any of them, probably like the art programming. So, traditionally, you have the fragmented tool, has to dependent limited. Okay, natural language input, SCP alert, and it's done. So it's a simple work, but it's to the focus. You can read all of this. Now, regulation and ethics. So the August 2026, okay, that's something I don't want to go much, but you're welcome to. The FDA have different types of rules and applications and how the things can be more optimized. It's counting the risk management and all of those things. So 5 takeaways this moment that foundation model era is real and contested. Ubuntu and Alpha Genome are genuine leaps, but rigorous benchmarking shows single cell foundation don't always beat linear based. So all the point, all the takeaways of all this discussion that I want to show it in here. So the first point is that foundation models are great. They're progressing brilliantly. We just need more time to adapt with our work. The second, clinical translation. So clinical translation precision that we need to see. We need to be very careful on this because it's a patient care. Um, Third, that big companies are coming like a force of nature. So all of them, and let's see how good we can go with, how we can better integrate to implement it in real time. The fourth is that a lot of new companies are coming. Also, recursion was very popular at the very time, but NVIDIA Lilly is the probably one of the best force, and Takeda and others is great. Governments is working on these things, but eventually we'll be on the track and we will be leading the field. That's for sure. These are the all references that you are looking for. So I would suggest you like, okay, if you want something, you should go in here. Every reference is in here, so you are welcome to read all of them. Or if you need anything, just let me know. I'm happy to discuss all these papers and all context. If you have any question, just you want to discuss, want to collaborate, either a company or individual or academician or the student want to learn or a fellows want to learn more, you know where to find me. Just send me an email and I would love to discuss more. That's all. Any question, anything, anywhere, just let me know. Take care. Bye.